a couple is infertile, then the attention is on the women. It's not true. 30% of infertile couple, the cause is from the man. Some people can't even speak in a forum just because they have not been able to achieve pregnancy. Within a space of 6 months, 1 year, a woman had joined to a man, is married. You start seeing people looking at her tummy and saying, what is happening?
As an expert, what exactly is infertility?
Okay. Infertility is the inability of a couple who are married or who are joined together or who agree to live together as a couple and wanting or desiring pregnancy, the inability of them to achieve that pregnancy within 12 months. That's after 12 months of having adequate sexual intercourse. So inability of a couple to achieve pregnancy after 12 months of having adequate sexual intercourse. By adequate sexual intercourse, we mean that such a couple would have been having sex at least 3 times a week, evenly spread apart. That's at least 3 times a week. The couple should have sex for 12 months. And then when they are not able to achieve pregnancy, such people are now tagged as infertile.
Now, let's go to the burden of infertility in our environment. In your practice, what have you seen? What is the burden of infertility?
Yeah, infertility. Okay, first, I want to quickly say that we no longer so much capitalize on infertility. Very soon, people will no longer say infertile. They will now be referring to subfertility. So that's it. Yes, the term infertility will very soon change to subfertility, in the sense that there is not the general belief that somehow people who are infertile, because of the advance in technology, they will be able to actually have children. So tagging people as infertile is like diminishing them, rather we say that they are subfertile. That means their fertility potential is not maximal, instead of saying they don't have fertility potential at all. So subfertility is a preferred term. Now, coming to the burden of infertility, it's quite high. It's about 10 to 15% of couple cannot achieve pregnancy. That means that if you have 10 people standing with you, 10 couple, 1 to 2 of them will not be able to achieve pregnancy within that space of time. Now, that's if using 2 years as a landmark, because previously people said that instead of using 1, why not use 2 years? When we define infertility, we said that it is when they are not being able to achieve pregnancy within 2 years. Now, within 1 year, 12 months. But within 2 years, about 10 to 15% of couple will not be able to achieve pregnancy. Then if you say within 1 year, about 20% of couples, as high as that, will not be able to achieve pregnancy. That shows that the burden is very big. Very, very, very big. So, and it's something worrisome. When people get married, especially in African region, when people get married, when people are united, even if with no legal backing, but a lot of people live together with the aim to bring forth children, So when they don't have it, like we are mentioning percentage 10 to 15% of people. But the truth is, so that couple, it is 100%. A couple who cannot achieve pregnancy is 100%, because they will be worried, especially in African setting where people will come and meet them, a lot of talk, they can't stand, they go to church, they hear sight talk, they go to mosque, they hear sight talk, they go to their village, it's even worse on them. So the burden on them is higher than just mere figure. It has to do with psychological impact, physical impact, social impact. Some people can't even speak in a forum just because they have not been able to achieve pregnancy. Within a space of 6 months, 1 year, a woman had joined to a man, is married. You start seeing people looking at her tummy and saying, what is happening? what is happening, you know. Actually, this burden is more on women than men, unfortunately, especially in Africa, you know. The burden is more on women. The tension, the pressure is more on women. So people have actually gone crazy because they are not being able to achieve pregnancy within a space of time, you know. So the burden is much. If I want to do on the burden, we may not go away from here, but something that is devastating.
Okay. Now, a very, very important question I want to ask is the causes of infertility. The cause of infertility, because in our present day generation right now, I'm particular about our lifestyle and what we do. Most time, people don't usually look at the future. We're just concerned about the now. So, what are those causes of infertility? One, in particular, for the youth, those habits, those thoughts we engage in that could tend to push most youth towards this problem of infertility.
Yeah. Thank you very much. That question is very crucial and very vital, because if you know the cause of a thing and you can prevent it, it's better than curing it. Now, the cause of infertility can be male, can be female, can be both. You know, the idea of the fact that a man is, a couple is infertile, then the attention is on the women, is not true. 30% of infertile couple, the cause is from the man. In fact, recent studies are proving that the cause of infertility is higher on the male side than the female side. In fact, there are papers that are now saying 36% of the cause of infertility is on the man. It's the man that is the cause of a couple not being able to. Why? Another 30%, the woman is the cause. Then 30% of couple that are infertile is because both of them has issues, yes, together. Why about 10%? In fact, now recently less than 10%, the man is okay, the woman is okay, but you don't just know why they could not achieve pregnancy. So let's just say 30% male, 30% female, 30% both of them, and then 10% you cannot tell why. So what are the causes in the man that can... Okay, let me start from the woman, because the attention is always on the woman first. Then I will talk about the man. Now, you know, the woman's reproductive organ spans from the her womb, the tube, the ovaries. Then there are other things in the body, like the brain. The brain sends the body that would help them to function well. So the causes ranges from, if I want to start from the womb, some women's womb are closed. Let me use that word. They are sealed, what we call synechia. They are sealed. I will talk about why those women's womb are sealed. Like, they don't menstruate well because their womb is sealed. Hey, that's number one. So uterine synechia, their womb is sealed, so they are not menstruating well, so they may not be able to achieve pregnancy. Another thing is that the tubes are blocked. So when a lady's tube is blocked, the egg cannot flow through the tube to the womb. So such a woman may not be able to achieve pregnancy. Another factor is hormonal imbalance. So the ovaries are not really generating good hormones that will help the womb to take up a pregnancy if it comes. So hormonal imbalance, and this hormonal imbalance can be due to the age of the woman. If a woman is aging, like greater than 35 years, the hormone will not be as a woman who is 22 years, 25 years, 28 years. So the closer a woman is to menopause, the more likely the hormones will be imbalanced, and such a woman will not be able to achieve pregnancy. Also, when a woman is aging, the ovaries are not, the eggs that are being released are not quality eggs. So those ovaries, if the eggs are not quality eggs, those eggs cannot really take up good sperm, and then pregnancy cannot come up. So you see that those age is a great factor to infertility in women. Then there's what called PCOS, polycystic ovarian syndrome. That is a cause of hormonal imbalance too. So, and it's common among young girls. You know, you see a young girl, he has beards, his thick, looks a little fat. So, and then his menses is irregular. Those people may have what we call polycystic ovarian syndrome, and they may not be able to achieve pregnancy. The other factors is also, you know, uterine fibroid. You'll be hearing fibroid. Yes, fibroid is not a direct cause of infertility, but have a role. You know, a fibroid can block the tube. A fibroid can stay inside the lining of the womb and so disrupt pregnancy to happen. So a woman with fibroid like that, especially when the fibroid is very big, may not be able to achieve pregnancy. Then also, brain, you know, I told you that there are connections between the brain and all the parts of the body. A woman who does excessive exercise, it may be those excessive exercise. You see all these athletes, and then people who do excessive exercise, they may not be able to have a good hormone flow. So those sets of people may experience infertility. Then, apart from exercise, stress can cause hormonal issues. You know, excessive stress on a woman. You know, a woman will say, I just got married, I have 3 jobs, I'm running head center, my family is putting pressure on me. Those stress can actually even reduce the hormone. The people who deliberately lose excessive weight, you know, you just lose those changes the hormone in this system and also causes a hormonal imbalance and can lead to infertility. Now, let me come back to the lining, the uterine synechia. When I say the womb be sealed, what can cause that? Now, when a woman have abortion, you know, you have an abortion in the places that shouldn't be, or in situations whereby you have an abortion, there is no care after the abortion, or the abortion was done in a very brutal way. Such a woman will bleed in that abortion period, and then there is no remedy. So the womb can be injured in that process. Usually, most of the time that we see those uterine synechia are people who had series of abortions, and then they injure the lining of the womb, and then the womb gets sealed up. So such a couple may have difficulty in achieving pregnancy because the womb is sealed, so she doesn't menstruate properly. She may be menstruating, but it's scanty, it's just small that is dropping, or her menstruation become irregular. Like she instead of menstruating 3 days, she now notice that she menstruates 1 or 2 times per month. So because the lining of the womb has reduced, and this is due to the abortive process that will happen. Then some people have what we call spontaneous abortion, but the whole product, the whole tissue, the whole fetus did not expel out. So, and they didn't visit the hospital facility to see how it can be washed out properly, then placed on ideal antibiotics. I use the word ideal because it's not just to put somebody on antibiotics. There are antibiotics that are not effective after an abortion process. So if the person doesn't have that ideal antibiotics, then the body tries to cure itself. The body heals itself wrongly. So the lining of the womb can get sealed up, and such a person may have difficulty in achieving pregnancy. If this same abortive process can also injure the tubes also. So the tube gets blocked, and that's where we come to tuber blockade that will make the person not to have the egg pass to the womb for fertilization. Also, you know, you hear of infection, pelvic inflammatory disease. You hear of PID. I'm trying to use terms that normal people outside use, you know. You hear PID, infection. Now, a woman who have series of infection in that area without appropriate treatment. Now, I am not against anybody having infection, because truly a woman who is sexually active in one time or the other in their life will experience a effective process. But having appropriate and adequate treatment of such infection is key to keep that reproductive organ effective, you know. So if a woman who had infection like that was poorly treated, the infection can spread to the tubes. The tubes are very tiny. So when they have such infection, when they heal, they just seal up. They just seal. If they heal without appropriate treatment, they just seal up. They just block. So you now see that such a person has a tuber blockade. They say, oh, she has tube blockade, so she will not be able to achieve pregnancy. So those are some of the things that I can talk about for women in order to save them. And then for men, the same thing. The funny thing about it is that many men have this silent infection that block their spermatic cord. The spermatic cord is what